Hi friends, this is Dr. Rao from Putra Medic in Kulim, Kedah. Recently there has been an outbreak of influenza throughout Malaysia and it's become a frenzy. A lot of parents are really worried about their kids and we have been receiving calls quite often requesting for the vaccine. It's sad to say that most of us have run out of the vaccine and we are still awaiting the new batch to be flown in from overseas. Now, I just would like to make a video to educate you regarding this influenza so that you understand better in the times where you don't have the vaccine on how to protect yourself and your loved ones. Now, some basic information. Influenza is different from avian flu. We have had an outbreak of avian flu, the bird flu. The bird flu does not really infect humans normally, but I think you guys can recall that we did have an outbreak some time back. Now, influenza, they are divided into two. There's A and B. They are similar, but influenza A spreads much faster than influenza B, and the symptoms of influenza A are usually more severe. The issue with influenza is it's pretty difficult to diagnose because it has got all the symptoms of a normal cold, fever, body ache. The only difference is that usually the fever is higher and patients become dehydrated very fast, they become very weak, they have body ache and they generally feel very lethargic. This is a differentiating symptom when you don't see the doctor. Of course, we will do a nasal swab to find out whether it's influenza or not. So this is the first fact. Number two is that the only protection against influenza is the vaccine. They do have a drug called oseltamivir or Tamiflu, which actually works against the virus, but it has to be taken roughly 24 to 36 hours before onset of symptoms. It can bring down the duration of the illness by 30 to 40% and the severity of the illness. That means you suffer lesser, about 40% lesser than when you don't take your oseltamivir. Taking it before as a precaution makes no sense because it just doesn't work that way. It's not a vaccine, you see. It is something like an antibiotic. But antibiotics work against bacteria, antivirals work against viruses. So this is the thing. So now coming to the point on how to protect yourself, of course I'm very sure that you have done your own research and a lot of you have known that staying indoors and covering your nose when you're sneezing, wear a mask if you're sick, stay away from people who look ill. These are general knowledge. Okay, what else you can do? The first thing is that you have to understand that the antivirus drug that fights against influenza is not really that effective. It just reduces the duration and the suffering, that's all. Therefore, the only thing that helps you is your immune system. So boosting up your immune system would be the key to actually recover from this illness much faster, and maybe protecting yourself by boosting your immune system up so that it has got a better defense against an invading influenza virus. Now, how do you do that? I generally believe that number one, you need to keep yourself hydrated. Dehydration actually gets your immune system down. It actually puts many of your systems operating at 50% of its effect probably. So keep yourself well hydrated, number one, especially during this hot season, December, January. Number two is that you have to make sure that you get enough sleep. When you're sleep deprived, you definitely have got a lower immune system. This is scientifically proven. All right. Number three is that certain vitamins have been proven to some sort increase your immune system. The first one being vitamin C. Vitamin C taken about 1,000 milligrams per day is sufficient. But I personally have gone up to 3,000 to 5,000 milligrams. There was once I went up to 10,000 milligrams experimenting, and it gave me a very bad diarrhea and also a heartburn. So don't exceed the dose of 3,000 milligrams if you want to superdose yourself. However, you cannot die from a vitamin C overdose, so don't worry about it. Right now, the other thing is that wearing a mask. Okay, now mask generally they are just a barrier, right? Unless you're talking about the N95, that has got a particulate filter. It can some sort bring down the chances of getting a virus attack very well. But the normal masks that you use, they have two layers. There's the white layer and the blue one. The white layer has got a filter, so if you are having a flu, the white should face your nose. If you're not having a flu, you want to protect yourself, wear it the other way where the blue faces your nose. Yeah, that is the other one. Okay. Now, I'm a keen believer in naturopathy. So when it comes to natural medicine, what can we do? The first one that boosts your immunity are, of course, echinates. Yeah, you can get it in the form of drops or tablets in the pharmacy. Yeah, they are proven actually to some sort of help to boost your immune system. The other ones are, of course, neem leaves. Neem leaves have got some purifying action. They too help to boost your immune system and also keep away other kind of viruses or bacteria, impurities in your blood. But they have to be taken quite regularly for quite a long time, yeah, because they are known as adaptogens. They don't work like how your Panadol works. They don't act immediately. And the third thing that really helps is turmeric, yeah, but this is not the turmeric that you buy from the supermarket to put into your curry powder. Yeah, turmeric here, we are talking about medical grade turmeric, which has got high extracts, high bioavailability of curcumin. The higher the bioavailability, the better. Yeah, so the bioavailability of the curcumin is what determines whether the curcumin is active or not. Yeah, this is very important for you. Okay, so I would suggest to get a general curcumin from any one of the pharmacies. Yeah, there are many brands. This will help as well. And finally is, of course, honey. Yeah, honey has got very good antibacterial, antifungal, antiviral properties. Now, hydrating yourself with pure raw honey mixed with some water, it's a good idea. You just keep on flowing. And of course, you can just take it raw just like that with a spoon, right? So I hope this little information is good enough for you. Don't be scared. The whole endemic will definitely settle down. I have heard from my colleagues that vaccines are on the way. But just rest assured, don't worry. It is not a big issue. So before I leave you, I'll just let you know that the two risk groups in influenza are adults 65 years and above, and also kids 2 years and below. Yeah, they can suffer. First thing is that dehydration. The second thing is pneumonia. Yeah, usually they get infected, super infected by a bacteria because of the immune system being already down. And of course, other symptoms like sinus, rhinitis, ear pain, and all these things. So these are the two groups that are at higher risks. However, I would strongly suggest, if you suspect, please see your nearby doctor. Let him or her do whatever is necessary to confirm, and take care.